Hi there, my name is Taylor Cowell. I'm joined with Sarah Northrup and Misty Galindo from Texas Panhandle Centers. And today we wanted to talk a little bit about National Suicide Prevention Month. First of all, if you're having any suicidal thoughts, you can always call TPC's Regional Crisis Hotline, which is 806-359-6699. So we want to present some sobering statistics to you, first of all, from the National Alliance on Mental Health about completing suicide. Every year, 44,000 Americans die by completing suicide, and it's actually the fourth highest cause leading death, I guess, in the United States. Men are 4 times more likely than women to complete suicide, and men over the age of 75 actually have the highest rates of completing suicide, I believe. Right.
I think these are very important topics today, especially when we're talking about young people, because it's very important that we do a lot of early intervention, and that's a primary focus of our agency. So when we're talking about teens and suicide, 80% of teens who die by suicide actually showed several of the warning signs prior to doing that. And also too, more teens die by suicide than a combination of the flu, AIDS, and cancer combined. There's also an interesting statistic for the LGBTQ community. Those youth are 4 times more likely to make attempts than their counterparts. So I think that's important to show that segment of the population has more difficulty than their peers.
Did you know that according to studies completed in Rhode Island, that 1.1 per 100,000 individuals who are diagnosed with having an intellectual and developmental disability complete suicide each year. 1 in 56 individuals who are on the autism spectrum complete suicide each year as well.
It's completing suicide affects everybody.
Right.
It doesn't have one age range, it doesn't have one race or one gender, it affects everybody.
Absolutely.
I think it's also important to note, I mean, we're mental health professionals, we work in the field, that is our profession, our calling, our day-to-day work. We are absolutely not immune. I mean, not only professionally, but personally, we've all experienced, some difficulty knowing people who have completed suicide, family members, friends. So we don't have all the answers here. And so I think it's of note to be sure people know that we're not immune.
So we also want to talk a little bit about the warning signs, what you as a friend or a family member, significant other, can look for in somebody if they're having maybe thoughts about suicide. Sarah, do you want to talk a little bit about that?
Absolutely. Some of the signs, and these are not things that may just happen in a blip of a moment. These are kind of over time that you notice that people are struggling with. Some things that we do look for is people actually verbalizing that they want to die. They talk about being a burden to others. Talk about not wanting to be around anymore. No one really appreciates me. I really don't see what the point is anymore. Increased use of alcohol or drugs is also a big warning sign. Sleeping too much, not sleeping enough. And also kind of looking for a way to complete that task, to complete suicide, whether that's talking about firearms, those types of things. Also, people have been known to give away prized possessions. That can be a warning sign. It's a whole lot different than just cleaning out your closet before summer starts. Also too, it's about having some really differing emotional ranges and displays of extreme mood swings. That's also something to look for. And then again, talking about maybe being a burden to others and not wanting to be here.
Yeah.
Yes.
All of these things are very important, and in combination or singly when you're talking to friends and family. So what do you do when you do come across someone, or you talk to a friend that has been displaying any or some of these warning signs? You really want to talk to them and make sure that they have an understanding that you're very concerned. And as mental health professionals, we're taught to not beat around the bush. I mean, we have to ask directly, because if we kind of go down the bunny trail and we're not addressing the issue, then we're never going to get the answer. And so it's very important that people ask, you know, are you having any thoughts about killing yourself, Missy? And that is a very sobering statement right there, and a sobering question.
So we talk about the warning signs and how they can happen over time. And Sarah and Taylor have graciously agreed to do a role play to kind of walk you through how to talk with someone who is having some suicidal thoughts. So Sarah and Taylor, take it away.
Okay. What's up, Sarah? I haven't seen you in a while. You haven't been coming to our weekly hangouts. What's going on?
Listen, I just kind of haven't been in the mood. And I mean, I know you guys have been texting and calling, and you know, I'm sorry I haven't answered, but I gotta tell you, I'm struggling.
Really?
Yeah.
Well, we kind of knew something was up, but well, you want to tell me a little bit what's going on? What are you struggling with?
Well, I was kind of hoping you guys would just think I was busy with work
Yeah.
and all those kinds of things, but you know, my brother passed away a couple of months ago, and I just haven't been able to get out of it on my own and just kind of pull myself up, and you know, I don't feel like myself. I'm sleeping a lot.
Yeah. Okay.
And work is hard. I mean, I've just really been feeling
Going
like
through it.
crap.
Yeah. Well, me and the guys, we kind of figured something was up, but we didn't know. But I guess that really bears the question now. You say you're sleeping a lot. You say you're having a hard time, anxious probably. Bears the question, are you having suicidal thoughts, sir?
You know, I mean, I hate to tell you this, but yes. I mean, I've been thinking, gosh, you know, maybe it's just better if I don't wake up in the mornings, if I don't go to work, is anybody really going to notice? And everything just seems hard.
Yeah.
You know, it seems hard to get through the day, and I just, but yeah, I've been having these intrusive thoughts about, you know, wanting to kill myself, and like that's never happened to me before.
Yeah, it's not like you. We've known you now for, what, 10 years now? And we care about you a lot, and if there's anything that we can do to help prevent this, we're going to do it. So, first of all, you say you don't want to really wake up in the morning. Is it just that, or is there really a plan in place for it?
You know, I've got some pills in the medicine cabinet,
Okay.
and I mean, I guess if push came to shove, I could do that. And I mean, the thought of that, it's not something that I want to do, but I keep thinking about it.
Yeah. What do we think about maybe getting those pills out of your house?
Oh
Just
my
to
gosh,
be safe.
that would
Yeah.
make me feel so much better,
Okay.
because I just almost kind of obsess about it.
Yeah, I mean, it's right there in front of you. You know, it's always going to be a temptation for you. So let's get it out. Let's put it somewhere safe for now until you start feeling better.
Okay.
Maybe get you. You said you have a counselor in the past, right?
Yeah, you know, I was in therapy for a long time, and
Yeah.
I think I think I need to call them. I really, I mean, I just think this whole loss is just it's just had more of an effect on me than what I thought.
Yeah.
And you know, and I just
Grieving's a process.
yeah.
Everyone goes through it. So
Well, thanks for reaching out. I really
Yeah.
appreciate it. I didn't think you guys would want to be around me if I was, you know, just
No.
doom and gloom.
no, we're your friends. That's why we're here for you. And we may know all the ins and outs about what's going on in your head, but if we can help in any way, that's what we're gonna do.
That's great. Thank you, Taylor.
You're welcome. All right. Pretty good.
So thank you guys for tuning in today. And remember, September is Suicide Prevention Month. And anyone has any questions or having some struggles, 806-359-6699. Thank you.